Understanding perimenopause, symptoms, and the rise of cougar puberty. Perimenopause, understanding the symptoms and the trend of cougar puberty. When Amanda reached the age of 42, she felt as if her own body had transformed into that of a stranger. She began experiencing sudden, hot flashes, sleepless nights, and irregular menstrual cycles, alongside an unexpected surge of emotions triggered by minor daily events. "I thought it was all due to stress," shared Amanda, a hospital administrator from Texas, in an interview with Euronews Health. However, even when her life settled down, the troubling symptoms continued unabated. "I consulted my doctor for blood tests, but everything came back normal, and I was advised to be patient," Amanda recounted, preferring to use only her first name. Then, the cycle would start all over again. It wasn't until a year later, during her most recent visit to the doctor, that her blood tests revealed low ovarian function. Confirming her suspicions, she was entering perimenopause. What exactly is perimenopause? Menopause signifies the conclusion of a woman's reproductive years, officially marked by the absence of menstruation for 12 consecutive months. The average age for women to experience menopause ranges from 45 to 55, as reported by the World Health Organization, WHO. The phase leading up to menopause is referred to as perimenopause, during which hormone levels begin to fluctuate and gradually decline. Symptoms can include sleep disturbances, hot flashes, cognitive fog, anxiety, mood swings, and irregular periods, according to the UK's National Health Service, NHS. Approximately 1 in 30 women under 40 are already experiencing menopause, indicating that many younger women may also be in perimenopause, explained Dr. Louise Newson, a menopause expert and founder of the Balance app, which offers tailored support for women facing menopausal symptoms. Factors such as family history, existing medical conditions, or treatments like surgery or chemotherapy can lead to an earlier onset of menopause. Dr. Newson added in her conversation with Euronews Health. Historically, perimenopause has been a topic shrouded in silence due to societal taboos, as noted by Dr. Newson. The lack of a definitive test for diagnosis has left many women feeling bewildered, isolated, and dismissed regarding their symptoms. "Many of my friends would brush off my worries about being menopausal because they thought, 'I'm older and I'm fine,'" Amanda expressed. The consequences of delayed recognition. Delays in recognizing perimenopause can have serious implications. A UK government report from last year highlighted that women suffering from reproductive health issues, such as endometriosis, often endure years of waiting for diagnosis or treatment, a situation described as medical misogyny. Symptoms of perimenopause can significantly affect a woman's quality of life, with nearly 40% of women reporting moderate to severe hot flashes and night sweats, according to a study published in the Lancet Diabetes Endocrinology. Despite this, research on perimenopause remains limited, and many women are misdiagnosed with conditions like depression, anxiety, arthritis, or fibromyalgia, which is characterized by widespread pain and fatigue, as noted by Dr. Newson. Amanda's experience reflects this troubling trend. "I visited the doctor several times, and they were always accommodating with my requests for tests and appointments. However, when nothing conclusive appeared, and they learned about my stress levels, my concerns were often dismissed," Amanda recounted. "I don't believe they were intentionally dismissive, but the term stress was used as a catch-all explanation for far too long." How is perimenopause managed? The primary treatment for perimenopause is hormone replacement therapy, HRT, which compensates for the body's decreasing levels of estrogen and progesterone, as outlined by the NHS. HRT can be delivered through various methods, including tablets, skin patches, implants, or topical gels and sprays. In cases where fatigue and low libido are significant issues, testosterone supplementation may be considered as an additional option. The specific hormones required and their dosages differ for each woman. There is no universal prescription that fits all, Dr. Newson emphasized. It's crucial to discuss your options with a healthcare professional to ensure you receive the most suitable treatment based on your unique situation, she added. The rise of cougar puberty and the movement towards destigmatization. As awareness of menopausal symptoms has increased, women have found community and support by sharing their experiences online. Last year, a TikTok user introduced the term cougar puberty to describe perimenopause, a humorous rebranding that quickly gained popularity, allowing others to reclaim their narratives and reduce the stigma surrounding the topic. It perfectly captures the experience. I've been calling it reverse puberty, one TikTok user commented. Another added, cougar puberty, I love the name. How about calling your hot flashes tropical moments? It sounds like a vacation. For far too long, perimenopause and menopause were subjects of hushed conversations or dismissed as something women simply had to endure. Dr. Newson remarked, the visibility and shared experiences we are witnessing now, especially online, are fostering better discussions and enhancing knowledge that should have been integrated into mainstream healthcare for decades. What are your thoughts on this topic? Have you or someone you know experienced similar symptoms? Let's discuss in the comments below.